VistaFlow Drug Screen Cup Operational Tutorial. The VistaFlow Drug Screen Cup comes in a box of 25 individually sealed devices. The label on the outside of each box contains specific product information of the contents, including specific listing of each drug detected and the cutoff level, catalog information number, item number, lot number, quantity, storage temperature, and expiration date. VistaFlow Test Cup detects multiple drugs and drug metabolites in human urine. Each box contains a product insert, adulteration color card chart, and 25 individually foil pouch sealed testing devices. Inside each box there is a product insert for your reference. It is important to review the product insert prior to administering the test, as the product insert contains critical information including the drugs tested and cutoff levels, summary and description of each drug, directions for use, interpretation of results, performance characteristics such as accuracy, analytical sensitivity, analytical specificity, and cross-reactivity. A copy of the product insert along with other written reference materials are available on our website, myvistaflow.com, or through your VistaFlow representative. When administering the VistaFlow Test Cup, it is important to ensure the test device is at room temperature, 15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit prior to testing. Do not open the test device pouch until ready to perform the test. When you are ready to administer the testing device, open the pouch and take out the test cup. The results section is covered and can be revealed by peeling back the blue tab from left to right. Depending on your preference, the results window can be exposed before or after the collection. The results window is covered to prevent the donor from seeing the results prior to the collector doing a formal interpretation. The 20-panel VistaFlow test cup used in this video contains single-line and multi-line test strips. In order to fit 20 drug strips into one device, there may be a few test strips that contain more than one drug. VistaFlow uses single strips in all our devices that detect up to 16 drugs. Beyond that, paired drugs are used on a single strip. Each test cup comes with easy-to-read interpretation instructions located at the base of the device. Also included on each test cup is a temperature strip. In addition to observed collections, the temperature strip is one of the most effective indicators of sample integrity. An acceptable urine temperature for drug tests falls between the range of 32 to 38 degrees Celsius or 90 to 100 degrees Fahrenheit. When obtained, the sample should register between 94 and 96 degrees Fahrenheit. Observing the temp strip should be one of the first actions taken upon sample collection to ensure the sample falls within acceptable temperatures. Synthetic urine and adulteration with water or other substances may not register the temperature within guidelines. Ensuring adequate temperature at the time of collection is a good way to rule out many forms of tampering. If a sample is out of range, have the donor provide another sample. Reading the adulteration pads. Inside each box of VistaFlow test kits is an adulteration chart. This chart should be referenced against the pads on the test cup for color match to determine if it is normal or abnormal. Further adulteration examination can be done by sending the sample to the lab. The VF20 panel in this video detects 6 different types of possible adulteration: specific gravity, pH, oxidants, creatinine, nitrate, and glutaraldehyde. As you can see compared to the chart, this sample is considered normal. We are now ready to begin interpreting the results. Write the donor information on the space provided on the cup. There is no minimum fill line required to activate the VF test cup, but approximately 30 milliliters of urine sample is recommended. Although less than 30 milliliters of urine will work with the device, it is important to collect enough of the sample to be sent off for confirmation if required. Once the sample is collected, tightly secure the lid. It is recommended test results be read 5 minutes after collection. One of the most important steps in reading the results is waiting long enough for the test lines to complete, especially on presumptive positive results. If a result does not have a line at the 3-minute mark, it would be premature to call it a presumptive positive, as the collector did not wait the full 5 minutes before looking for a hint of line. Calling presumptive positive too early leads to contested results and non-confirming lab results. Results are considered valid for 60 minutes after collection. Interpreting results. As you can see, many of the results begin to appear within seconds as the strip begins to flow. It is recommended the results be read after 5 minutes, but in some instances, the results will be available sooner, especially with a negative sample. Once the control line is present, the test can be considered valid and ready to read. As you can see, the C and T lines have already formed on most of the strips. Once a hint of line appears in the T section and the C line is present, that strip can be ruled negative. If no line appears in the T section and the C is present, that strip can be considered presumptive positive. It is strongly recommended waiting the entire 5-minute window before determining the sample to be presumptive positive. You will want to give that test line all 5 minutes to develop. If after 5 minutes there is no hint of a line, then move on to your next step for handling presumptive positives. In this diagram, there is a test line present for both benzo and ETG, making them negative samples, while the lack of a test line for the cocaine strip would make it a presumptive positive. For the multi-line test strips, the test line is labeled T1 and T2. T1 corresponds with the bottom drug, and T2 with the top. In this diagram, the multi-test strip contains T1 cocaine and T2 THC. The T1 cocaine does not have a test line present and is presumptive positive, while the T2 THC does have a test line present and should be considered negative. The single test strip for GAB is considered negative as there is a line present. If the sample is negative and no other action is required, safely dispose of the sample and sample cup. If the sample is presumptive positive, seal according to your policy and procedures for dealing with the presumptive positive samples, such as sending off to a lab for confirmation or other storage options. Always refer to the test procedure card and the product insert for operating instructions. For questions relating to operating any VistaFlow drug testing device, please contact your VistaFlow sales representative at 866-210-2272 or through our website, myvistaflow.com.